Whole body health. One of the best tests that we do in our office is called the stomach juice test. So if you're having GERD or acid reflux or poor digestion, this is one of the best tests that you can possibly do to figure out what's going on with your digestion. And so we always talk about the stomach as the first domino of not only your digestive health, but your overall health. If your stomach isn't right, the rest of your health cannot be right. And so let's talk about this. First, so many people are confused about the stomach. The stomach is supposed to have an extremely acidic pH. In fact, the stomach juices that are sitting in your stomach right now should be a pH of around 2. So battery acid is like a little over 3. So the stomach juices you have are more acidic than battery acid. This is normal. This is healthy. And so why are so many of us having acid reflux? So many of us think that we have too much acid, but that's really impossible. What happens is one of two things. As we age, we produce less stomach juices. As we're stressed, we produce even less. So oftentimes, a 50-year-old man or woman is only producing like 15 or 20% of the stomach juice that they had when they were 18 years old. And so what we find is most people who are having acid reflux, I know this is going to sound crazy, actually don't have enough acid. They have too little stomach juice. And so with the stomach juice, here's what you do. It's simple. If you're having any health problems whatsoever, but most especially stomach issues or digestive issues, what you do is you take 2 tablets of stomach juice with every single meal. What you're doing is you're putting the stomach juice back into your stomach so that you can complete digestion faster. The reason that we get the acid reflux is not because we have too much acid, it's because when we eat food like, wings or pizza or something that's really hard to digest, the stomach, it churns and churns and churns, sort of like a washing machine trying to break apart the protein bonds and absorb the minerals and get the vitamin B6 that it needs. But if you don't have a lot of stomach juice, or if you're eating food that's really, really, really hard to digest, like a lot of processed foods, the food will just sit there and sit there and sit there and churn and churn and churn, and eventually it creates back pressure, which actually pushes acid above the valve and creates burning. And so you have 2 options. One, you can put out the fire, so to speak, with an antacid. But the problem with antacids is they shut down your digestive system. Literally, they make it so that you cannot break apart your protein bonds and you can't absorb your minerals out. I had a patient who came to me yesterday, poor guy. He had been on an antacid for 4 years, prescription level, and he had just been diagnosed with osteopenia. Not only that, but he was having a lot of other issues, having severe back pain. He was having emotional issues. And I believe it was from chronically blocking his stomach from absorbing the nutrition that he needed. And so what I did is what I'm recommending you do right now. I gave him stomach juice, and I said, just listen to me. Take a couple of tablets of stomach juice with every meal, and let's just see what happens. One of a couple things is going to happen. It's either going to fix it, or it's going to make it worse, right? If it fixes it, problem solved. You've realized that your acid reflux, your GERD, your digestive issues are from chronically low stomach juice. You take 2 tablets and you fix the problem. If it makes it worse, it's not that you have too much acid, it's that you have a hiatal hernia. It means that that one-way valve is stuck open. And in another video, I'm going to teach you how to diagnose and treat your own hiatal hernia. So start with a stomach juice test. Remember, 2 tablets with each meal, so 6 tablets a day. And see if it takes away your digestive issues and your other health issues. If it does, you've proven to yourself that you have low stomach juices, and taking more stomach juice is the solution.